Hello everyone. In this video, I will be providing a summary of US FDA new drug approvals in the first quarter of 2025. There are 7 new drug approvals from the first quarter with indications ranging from oncology, pain management, antibiotics, to hemophilia. Chemically, these 7 new drug approvals include 1 injectable antibody drug conjugates, 4 oral and 1 injectable small molecules, and 1 injectable small interfering RNA molecule. Now I'm going to dive into each medication in more detail. So the first drug approved in 2025 is the datopotamab deruxtecan, the brand name DATROWAY. This medication was approved by the US FDA on January 17, 2025, and indicated to treat adult patients with unresectable or metastatic hormone receptor positive and HER2 negative breast cancer. Recommended dosage for this medication is a weight-based dosing. It's 6 mg per kilogram RV infusion once every 3 weeks. As you can see, based on this drug molecule, also based on this drug name, it's a mAb and also deruxtecan. So this is the antibody drug conjugate. So basically, this is the macromolecule, the monoclonal antibody, and this one is attached with this small molecule, the DXd, the payload. In this case, it's a small molecule topoisomerase 1 inhibitor. Mechanistically, what happens for this ADC compound, and this molecule will be delivered to the cancer cells. For example, the antibody will bind with the TROP2 receptor expressing cancer cells. Once the ADC, the complex, the drug molecule bound with the receptor, the TROP2, and this complex will be internalized within the cancer cells. This will further releasing this small molecule, the DXd, within the cancer cells, ultimately causing the programmed cell death, apoptosis. So currently, there are 13 antibody drug conjugates in the US. Also, this is the second antibody drug conjugate to target this TROP2 receptor on the cancer cells. If we look at the pharmacokinetic profile, but first of all, I want to see the data in red refer to this DXd, the small molecule. So the protein binding is 98% for the small molecule DXd compound. The volume of distribution at the steady state is 3.5 liters. As mentioned, this ADC compound, antibody drug conjugates, will be metabolized to release the DXd small molecule via intracellular cleavage. Once relieved, this small molecule will be metabolized by CYP3A4 enzyme. The half-life for this ADC compound is about 4.8 days. And then the half-life for this small molecule DXd compound is 5.5 days. One thing I also want to note, so in this particular case for antibody drug conjugates, each monoclonal antibody is attached to 4 this DXd compound. So therefore, you can see there's number 4 there, and this refers to the drug antibody ratio. The adverse effects are greater than or equal to 20%. Stomatitis, that's the inflammation related to the mouth and gums. Nausea, fatigue, alopecia, constipation, and ocular disorders like dry eye and keratitis. With regard to the lab abnormality, so this would decrease the blood cell counts. So for example, decrease the leukocytes, decrease the lymphocytes, and decrease the neutrophils. So in addition, this medication will impact the liver enzyme as well in the blood. So therefore, you can see increase the ALT and also increase the AST enzymes. The next medication is treosulfan. The brand name is GRAFAPEX, This medication was approved by the US FDA on January 22, 2025, and indicated with fludarabine as a preparative regimen for allogeneic hematopoietic stem cell transplantation in adults and pediatric patients for 1 year and older with acute myeloid leukemia or myelodysplastic syndrome, for short AML and MDS. The recommended dosing for this medication is based on the body surface area, is 10 grams per square meter per day, given as RV infusion on days -4, -3, and -2, in combination with the fludarabine, which is another nucleoside anti-metabolite agents, followed by the stem cell infusion on day 1. So which means this medication is given 2 days, 3 days, 4 days before the stem cell infusion, right? So therefore this is called as a preparative regimen for this blood cancer. This medication also carries the US box warning, myelosuppression. Mechanistically, this is a prodrug. It works as a bifunctional DNA alkylating agent. A prodrug, which means it needs to be bioactivated in vivo in the body and to produce the active metabolites. It's also, this one works as a bifunctional DNA alkylating agent. So if you look at the small molecule, the drug chemistry, so this is a small molecule. You may recall this is very similar to another older alkylating agent called busulfan, like a busulfan. And so basically this medication, this molecule have 2 additional hydroxy there. And for busulfan, so missing these 2 hydroxy. Molecule weight is 278.3 grams per mole. And hydrogen bond acceptor 8. And so the acceptor, which means the number of hydrogens and oxygens within the drug molecule. Hydrogen bond donor is 2, so refer to how many hydroxy within the drug molecule, how many like an NH group in the drug molecule. Log P is negative 1.64. It's negative, so it's a pretty hydrophilic molecule. Polar surface area, so 144 square angstrom. So as mentioned, this is a prodrug. So what happens, the alcohol, secondary alcohol, this one will attack this carbon. This methyl sulfonate group will leave. So therefore, this will form this epoxide intermediate. And once forming epoxide intermediate, the guanine on the DNA double helix, the nuclear base, will attack the epoxide. So therefore, this would form the cross-linked DNA small molecule adduct, and so have this anti-cancer effects. Pharmacokinetically, volume of distribution 20 to 47 liter, metabolism. This will be converted into the active epoxide intermediates, half-life about 2 hours, excretion in the urine 14 to 40% as a parent drug molecule in the first 24 hours after RV infusion. Drug-drug interactions and substrates for CYP3A4 or CYP2C19, for example, medicinal products with a narrow therapeutic index avoid concomitant use with GRAFAPEX. The reason for that, this treosulfan molecule is CYP3A4 and CYP2C19 inhibitor. So therefore, if you take this medication together, this would increase the drug exposure for other medication substrates if they are CYP3A4 or CYP2C19 substrates. So this would increase the drug exposure. So therefore, have to be very mindful, avoid concomitant use. Contraindications in patients with the hypersensitivity to GRAFAPEX or to any ingredients within this drug product. The adverse effects greater than or equal to 20%, musculoskeletal pain, stomatitis, pyrexia, fever, nausea, edema, infection, and vomiting. So for example, right, this medication have the US box warning for myelosuppression. So therefore, this would we expect patients will be more prone to bacterial or viral infections, for example. The next medication, that's suzetrigine, brand name is JOURNAVX. And this medication is available as a 50 milligram tablets. This medication was approved by the US FDA on January 30th, 2025, and indicated to treat adult patients with moderate to severe acute pain. You can see here, right, it's for the treatment of moderate to severe, but in addition, this medication was approved for acute pains, not really for chronic pain management. So recommended dosing for this medication is starting 100 milligram, like 2 tablets after 12 hours, and then take 1 tablet, 50 milligram, and twice daily, with or without food. And then if you look at the drug molecule, the drug chemistry, so this is a small molecule, a very interesting drug structure with 4 chiral centers there, and the molecule weights 473.4 gram per mole, hydrogen bond acceptor 7, hydrogen bond donor 3, log P 3.55, polar surface area so 104 square angstrom. So given the multiple chirals within the drug molecule, so there are also 2 fluorine there and a trifluoromethyl. I think the drug cost there can be the barrier for patients. Mechanistically, this medication works as a selective blocker of the NAV 1.8 voltage-gated sodium channel. Basically, this one works as a sodium channel blocker, but it's a subtype selective for 1.8 sodium channel. So therefore inhibit the transmission of P signal to the spinal cord and the brain. So this is very important. This medication works peripherally, basically from the point of the pain transmission. Pharmacokinetically, the Tmax, it's about 3 hours, half-life 23.6 hours, protein binding 99%, volume of distribution 495 liter. Metabolism, this medication is metabolized by CYP3A enzyme. What does this mean? So you have to really make a connection, pay attention to drug-drug interactions, right? We'll be elaborating that shortly. Excretion, urine 44% as metabolized, in the feces 50% as metabolized. Drug-drug interactions, strong CYP3 inhibitors or strong moderate CYP3 inducers avoid concomitant use because this medication is metabolized by CYP3 enzymes. So for patients, if they take other medication, if there are CYP3, for example, inhibitor, this would increase the drug exposure for this medication. If the patients take other strong or moderate CYP3A inducer, so this would lower the drug exposure for suzetrigine. So therefore, this can have the less therapeutic effects. So for moderate CYP3 inhibitors, you have to adjust the dose, like lower the JOURNAVX dose accordingly. CYP3A subjects monitor closely and or adjust the subject dose if needed. The reason for this is this medication, suzetrigine, is also CYP3A inducer. So therefore, for patients, if they take other CYP3 subjects, so they will get lower exposure for other CYP3A subjects. So therefore, you have to monitor closely. In the similar context, for patients taking the hormonal contraceptives may require additional non-hormonal contraceptive method or alternative hormonal contraceptive. Otherwise, due to this enzyme CYP3 induction effect, and the patient can get a lower exposure for hormonal contraceptive agents. So therefore, they can get like expected pregnancy, for example. Contraindications, concomitant use with strong CYP3 inhibitors, you can see need to be avoided. Adverse effects, pruritus, rash, muscle spasm. This also will increase the enzyme level for creatine phosphorus. The next medication, that's mirdametinib. This brand name is GOMEKLI. This medication is available as a capsule, 1 milligram and 2 milligram dosage forms, and also available as tablets for oral suspension, 1 milligram dosage forms. This medication was approved by the US FDA on February 11, 2025, and indicated to treat patients, adult and pediatric patients for 2 years and older with the neurofibromatosis type 1, for short, NF1. So this NF1 is a genetic disorder causing the cancerous benign tumor growth on nerves throughout the body. So this is NF1. If we look at this molecules, again, it's a small molecule, kind of interesting with serofluorine, and also have this dihydroxypropyl and this motif. Recommended dosing for this medication, 2 milligram per square meter, twice daily dosing, with or without food. So therefore, this medication is also based on the body surface area based dosing. The drug chemistry, molecular weights, 482.2 gram per mole, hydrogen bond acceptor 6, hydrogen bond donor 4, log P is over 6, right? 6.16. Polar surface areas 91 square angstrom. Given the high log P, because you can see there is iodine atoms right within the drug molecule, so that's make the drug molecule more lipophilic. Mechanistically, this medication works as an inhibitor for mitogen-activated protein kinase 1 and 2. That's the MEK1 and 2, eventually blocking this downstream phosphorylation pathway, extracellular signal-related kinase pathway, ERK pathway. If we look at the pharmacokinetic profiles, Tmax around 1 hour, volume of distribution 255 liter. Protein binding is pretty high, more than 99%. Metabolism, you can see this medication is not really metabolized by CYP enzyme, so will be metabolized by this UGT, that's the uridine diphosphates glucosyltransferase, also the CES, that's the carboxylesterase enzyme. And because of the presence of this 2-hydroxy, so this would conjugate with glucuronic acid go through the phase 2 conjugation metabolism. So in addition, this carboxylesterase would oxidize this linkage there, right, to metabolize the drug molecule. Half-life 28 hours. So pretty long half-life in this case, and therefore it's twice daily dosing. Given the medication drug molecule is not really metabolized by CYP enzymes, so therefore that's don't expect to have too much drug-drug interactions. Actually, that's the drug-drug interaction information is not currently available on the prescribed information. For the adverse effects, more than 25%, adults, rash, diarrhea, nausea, musculoskeletal pain, vomiting, fatigue. For pediatric patients, and there are some unique adverse effects, for example, abdominal pain, pyronychia, so that's related to inflammation of the tissue around nails, like fingernails or toenails. Left ventricular dysfunction. Vimseltinib, as you can see based on the drug name, so ending as a T-nib, so therefore this is a kinase inhibitor. The brand name, that's ROMVIMZA. This medication is available as a capsule, 14 milligram, 20 milligram, 30 milligram dosage forms. This medication was approved by the US FDA on February 14th, 2025, and indicated to treat adult patients with symptomatic tenosynovial giant cell tumor. For short, that's the TGCT. Recommended dosage for this medication 30 mg twice weekly. So with at least 3 days apart between 2 doses. Mechanistically, this medication works as a kinase inhibitor, again because the molecule ending as TNIB is a kinase inhibitor blocking colony stimulating factor 1 receptor. So blocking that receptor, so therefore this would decrease the inflammation and the cancer. If we look at the drug chemistry, the Vimseltinib, again, this is a small molecule kinase inhibitor with a pyrazole motif, pyridine, and molecular weight 431.5 gram per mole, hydrogen bond acceptor 9, hydrogen bond donor 1, log P 2.33, polar surface area 98 square angstrom. Pharmacokinetics, Tmax around 1 hour for this medication, volume of distribution 90 liter, protein binding 96.5%, metabolism, oxidation, I think that related to isopropyl will be oxidized, N-demethylation, and also N-deacylation, so could be here. Half-life 6 days, so this is very long for this small molecule inhibitor, so therefore this also related to kind of twice weekly dosing. Excretion, this medication will be excreted in the urine 38%, but around 5% as a parent drug molecule. In the feces 43%, but 9% as a parent drug molecule. Drug-drug interactions, P-glycoprotein substrates, avoid concomitant use. If unavoidable, you have to space out the medication accordingly. You have to take this ROMVIMZA at least 4 hours prior to P-glycoprotein substrates. For breast cancer resistant protein substrates or organic cation transporter 2 OCT substrates, avoid concomitant use with ROMVIMZA. So the reason for that, this medication Vimseltinib is an inhibitor for P-glycoprotein. It's an inhibitor for BCRP and OCT transporter. So therefore, if they take all this medication together, because Vimseltinib is an inhibitor, so therefore you will get a high exposure for P-glycoprotein substrates, other medication. So therefore you have to either space out the medication, or in some cases you have to avoid concomitant use. Adverse effects, most common adverse effects greater than or equal to 20%, periorbital edema, fatigue, rash, peripheral edema, face edema, and pruritus. This gepotidacin, the brand name is BLUJEPA, was approved by the US FDA on March 25th, 2025. As you can see, this medication is available as a tablet. It's an oral medication available as tablets. The strength is 750 milligram. This medication is indicated to treat female, adult, and pediatric patients 12 years and older, weighing at least 40 kilograms, so which is 88 pounds, with uncomplicated urinary tract infections caused by the following susceptible microorganisms. For example, E. coli, Klebsiella, pneumonia, Citrobacter, Flindai complex. So all these, they are gram-negative bacterial pathogens, along with some other gram-positive microorganisms. So for example, Staphylococcus, Saprophyticus, and Enterococcus faecalis. The recommended dosage for this medication is 1500 milligrams, so which is 2 tablets, twice daily dosing, approximately 12 hours apart. The duration for the treatment is 5 days. So if we look at the drug chemistry, this is a small molecule on the left side. So there is a tricyclic ring motif. So therefore this particle triazine is nephrolithin motif. So it's considered a novel chemotype. In the middle, so that's the linker portion with piperidine motif, tertiary amine, and also secondary amine coming in the linker portion. There's also a tail moiety on the right side. So the molecular weight for this medication is 448.5 gram per mole. Hydrogen bond acceptor is 9. So hydrogen bond acceptor refers to the number of oxygen and the nitrogens. In this case, it's 9. Hydrogen bond donor is 1. Hydrogen bond donor refers to the number of hydroxys like OH or the NH group. So in this case, there's no hydroxy within the drug molecule, so there is one secondary amine like NH group. So therefore, the hydrogen bond donor is 1 in this case. Log P is negative 0.16. It's a pretty hydrophilic drug molecule. Polar surface area PSA is 90 square angstrom. Mechanistically, this medication works to inhibit the bacterial type 2 topoisomerase, more specifically that's the DNA gyrase and the topoisomerase 4. So these enzymes plays very important role in the DNA replication. And so this small molecule can inhibit both enzymes, have these two targets, so therefore blocking the DNA replication. As you may recall, there's another very important antibiotics called fluoroquinolone, can also target this enzyme like DNA gyrase and the topoisomerase 4. But given their structure, it's different chemical scaffold, different chemical structure, so therefore they have a distinct inhibition mechanism for this enzyme. So therefore, don't expect to have this drug, cross-drug resistance issue. If we look at the pharmacokinetic profiles, the Tmax, so that's the time to reach the maximal drug concentration in the blood. So it's about 2 hours. Oral bioavailability, so the absolute oral bioavailability is about 45%. Volume of distribution at steady state is 172.9 liter. Protein binding is 25 to 41%. Metabolism, and this medication drug molecule is metabolized primarily by CYP3A4 enzyme. Half-life, T-half, is about 9.3 hours. Excretion profiles, it's excreted in the urine 31%, but 20% as a parent drug molecule. About 52% excreted in feces, about 30% as the parent drug molecule. So as mentioned, given the drug molecule is metabolized by CYP3A4 enzyme, so therefore we would expect the drug-drug interactions. So for example, for patients, if they take some other medication, if there are CYP3A4 inhibitor, like strong CYP3A4 inhibitor, for example, the conazole and the fungal agents like intraconazole, ketoconazole, if they take this together and the fungal agents with these antibiotics, so this would kind of increase the drug exposure for gepotidacin. In contrast, for patients, if they also take strong CYP3A4 inducer, for example, rifampin, so that's the anti-tuberculosis medication. It's a strong CYP3A4 inducer, so therefore that would decrease the drug exposure for gepotidacin, this medication. So therefore have to avoid the concomitant use. Interestingly, in some cases, if patients also take some other medication, if they are CYP3A4 subjects, in particular with the narrow therapeutic index, you have to avoid the concomitant use as well. So the reason for that, because this new medication gepotidacin is a CYP3/4 inhibitor. So therefore, if they take together, and then you would see higher exposure for some other medication for certain CYP3/4 subjects. So therefore, in all these scenarios, CYP3/4 inhibitor, strong CYP3/4 inhibitor, strong CYP3/4 inducer, some certain CYP3/4 subjects with the narrow therapeutic index have to avoid the concomitant use. Digoxin, and that's the cardiac glycoside for the treatment for heart conditions. If the patients take digoxin together with gepotidacin, you have to monitor digoxin serum concentration closely. So the reason for that is gepotidacin, this new medication, is a P-glycoprotein inhibitor. And then, as you know, this digoxin is a subject for P-glyco efflux pump. So therefore, if they take these two medications together, this would increase the drug exposure for digoxin medication. So therefore, to avoid the adverse effects, have to monitor the digoxin serum concentration closely. Contraindication, a history of severe hypersensitivity to BLUJEPA is contraindicated. With regard to adverse effects, the most common adverse effects for this medication, gepotidacin, diarrhea, nausea, kind of the GR related. So this is pretty common for any systemic antibiotics and the diarrhea, nausea. In addition, the abdominal pain, flatulence, soft feces, vomiting. So there are also kind of GR related the adverse effects. So in addition, the headache, dizziness, and also vulvovaginal candidiasis. So that's the kind of the yeast infections. So given the adverse effects related to like GI disorders, so therefore this medication is recommended to take this medication after a meal. Try to, in effort to mitigate the GI associated intolerance. Fludarabine, the brand name QFITLIA. This medication was approved by the US FDA on March 28, 2025, and indicated for routine prophylaxis to prevent or reduce the frequency of bleeding episodes in adults and pediatric patients aged 12 years and older with hemophilia A or B, with or without factor VIII or IX inhibitors. As you can see, this is a chemically modified double-stranded small interfering ribonucleic acid, for short sRNA, in acetyl-galactosamine, that's for short GOMEKLI conjugates. So as you can see, based on chemical structure on the left portion, so that's the small interfering RNA. So in the middle, that's the linker, so conjugates with this in acetyl-galactosamine sugar moiety. This medication is also carries US box warning, thrombotic events and acute and recurrent gallbladder disease. With regard to recommended dosing, yes, the starting dose for this medication is 50 mg subcutaneous injection every 2 months. Then based on the target's antithrombin activity level 15 to 35%. So based on this target's activity level, then adjust the dosing or the dosing frequency accordingly. Mechanistically, this medication works as a antithrombin AT-directed small interfering RNA, degrading AT messenger RNA via RNA interference. So therefore, this would lower the plasma antithrombin levels, and as a result, so this would increase the plasma thrombin levels. Pharmacokinetic kinetically, and this data based on the 2 studies from 20 milligram dosing as well as 50 milligram dosing. Just take a 50 milligram dosing as an example. The Tmax is 3.78 hours, so that's the time to reach the maximal drug concentration in the plasma. Volume of distribution at steady state is 570 liter. Protein binding is 96.6%. Metabolism, so this small interfering molecule will be metabolized into short and smaller nucleotide fragments via endo and exo nucleases. Also notably, so this medication is not really the CYP450 enzyme substrates. So therefore, when we think about the drug-drug interactions standpoint, so we don't expect much drug-drug interactions with the CYP enzyme inducer, for example, as well as inhibitors. Half-life, it's 7.98 hours. Excretion in the urine 14.6% as a parent drug molecule in the first 24 hours. Drug-drug interactions, QFITLIA prophylaxis leads to increased thrombin levels with the additive increase in peak thrombin when used concomitantly with the CFC, so that's the clotting factor concentrates, or the BPA, so that's the bypassing agents. Adverse effects more than 10%, and viral infection, nasopharyngitis, bacterial infection. Finally, this is all the key reference which I have used to prepare this video. As always, the FDA novel drug approval for 2025 is a very valuable resource. All the medication information which are presented today are based on the prescribing information for the products. You can access these documents through the manufacturer website, or you can access these documents from the US FDA website as well. All the physicochemical properties for the drug molecule was based on this chemspider.com. Finally, I want to thank you all so much for watching, and subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.